Hi, this is Dr. Harry. Oftentimes, if we're experiencing aches or pains or fevers, we reach for ibuprofen, Advil, Motrin, because we know it's going to make us feel better. But should we be concerned that if we perhaps are infected with the coronavirus, that this may make our symptoms worse? Well, some information that recently came out of France raises some concerns about this. The health ministry is concerned that using ibuprofen during COVID may actually increase our risk of getting significant pneumonias and worsening the course of the disease. Now, there have really been no long-term significant studies, of course, because this disease is relatively new. What we do know about ibuprofen is that it is an anti-inflammatory, and that is primarily how it works. What we also know about it is that people with chronic kidney conditions should be cautious using ibuprofen, if at all. And also, there are some concerns about people at risk for cardiovascular disease using ibuprofen on a continual basis. If you also have gastrointestinal problem or bleeding ulcers, it's also strongly advised that you avoid using anti-inflammatories such as ibuprofen. Since elderly people with chronic illnesses are more at risk for complications, I can certainly see how ibuprofen could potentially be a concern. If you have questions about whether you should use ibuprofen and what the concerns are for you, I would really recommend speaking to your physician first, because he or she is best familiar with your medical condition and can best advise you about this situation. Now, until this shakes out, if you're experiencing if you're concerned about taking ibuprofen, then an alternative would be acetaminophen or Tylenol. Of course, there are concerns about using Tylenol for people with chronic liver conditions, as Tylenol could potentially worsen that. So if you are taking acetaminophen, please be sure to follow the directions on the bottle and do not take more than is indicated. My personal preference as well is to also avoid the long-acting Tylenols. Again, before you make any decisions about your health from things that you have heard from the internet, it's important to speak with your physician first, as he or she, again, is more familiar with your conditions. In the interim, things that we can still continue to do is make sure we have proper hand washing techniques, avoid touching our eyes, nose, and our mouths, practice social distancing as much as we possibly can, because together we can get this under control and we will get to the other side of this. So until then, this is Dr. Harry. Bye-bye.